Hello, good afternoon from Geneva. Good morning and good evening, everyone from around the world. Welcome back for another Ask WHO Social Media Live Q&A session. My name is Yanwit Desh Panyawat, and I work in the Department of Communications at WHO headquarters. If you follow us today on social media, we have started sharing some content around World Sight Day, which is today, the 14th of October. Every year we celebrate World Sight Day, and that's why we are here with you to talk about vision, eye care, how to take care of your eyes, debunk some common myths, and of course, to get some of your questions answered. And it is my great pleasure to have with us in the program today a specialist from WHO's Vision and Eye Care program. Welcome, Mitasha Yu. How are you doing?
Thank you. I'm doing great. Thank you. And happy World Sight Day to
Great.
everyone out there.
Great. All right. Mitasha, to kick off our conversation today, how about you tell our viewers about World Sight Day? What is it about? And what's the theme of this year's World Sight Day?
Thank you. So World Sight Day is a day that is celebrated everywhere around the world and is to raise awareness about blindness and vision impairment being a major international public health issue. We also use it as an opportunity to talk to our community leaders about the importance of prioritizing eye care and to improve a person's overall health and well-being. So the theme of this year's World Sight Day is very exciting. It's love your eyes or love our eyes. And, you know, in the last couple of years now, the pandemic has been on. We've been really using our eyes in a different way. We've been in front of our screens, in front of our devices, and even missing some of our eye test appointments because of lockdowns or reduced access. So now we're just trying to bring the attention back to our eyes, prioritize and protect our eyesight, and that's what the messaging and the theme is about. And also, really another way to remind ourselves our eyes are important. We need to appreciate them. We use them in every single part of our lives, and we need to love our eyes.
Thank you very much, Mitasha, a great introduction. So today, just before I get back to you with more questions, I would like to welcome our amazing fans and viewers who are joining us from all corners of the world. As usual, today's topic is about vision and eye care on the occasion of World Sight Day 2021. To ask your question on Twitter, use hashtag Ask WHO. So don't forget to, add a hashtag so the whole team can monitor and create your questions on Twitter. And those of you watching us on Facebook, simply leave your question in the comment section. We have a whole team, working behind the scene and creating your questions for us. Well, I know you have already mentioned briefly in introduction, Mitasha. When it comes to World Sight Day at WHO, we often talk about blindness and vision impairment or eye-related diseases. Could you tell us more about the global overview of vision impairment and perhaps go a bit into more details on what are the leading causes of blindness and vision impairment worldwide?
Thank you. So it's estimated that more than 2 billion people in this world have vision impairment or blindness, and half of that's 1 billion people, could have been prevented for or is yet to be addressed. So that's a huge figure. And this figure is only going to get worse and increase substantially due to the population growth, the aging, changes in lifestyle, such as people spending more time on their devices and less time outdoors. So it's going to be a real shift in how we try and prioritize vision impairment and blindness. And that's why we want to raise more and more awareness through World Sight Day and other events. And the leading causes of vision impairment and blindness around the world are refractive error, so that's needing glasses to see, and cataracts. And slowly followed after that is age-related macular degeneration, glaucoma, diabetic retinopathy, corneal opacity, and trachoma. So there's some technical words in there, but really there is a big focus on needing glasses to see and cataracts, which most people have heard of.
Thank you, Mitasha. Actually, your audio is a little bit cracking up. Would can you try one more time?
Does that sound any better?
Yeah, a little bit better. Okay,
Okay, I'll
cool.
try and speak louder and clearer.
Thanks. All right. Let me look at the questions. Well, I know what you just said. It's very critical, and thank you. I saw some like questions popping up now on my screen. Before we take the first one, I just like to ask you one more question to follow on what you've just said, so you can tell us more about what are the effects that these diseases, blindness, vision impairment, could have on our life, and who is the most vulnerable or who should pay more attention to this particular matter.
Yes. So the effects that blindness and vision impairment have on your life, just think about how much you use your life in everyday things that you do, your daily personal activities, interacting with your friends, your family, your loved ones, your community, going to school, learning at school, working, opportunities for working, being productive at work, anything you do in your life involve your eyes. So if you are having vision impairment or blindness conditions that in your eyes, that will really be impacted severely with these problems. And the most vulnerable populations, as you're asking, are women and girls, people living in rural and remote communities, people with disabilities, and marginalised populations. They tend to have these be most vulnerable because they have reduced access to services. So again, through World Sight Day, we want to bring awareness that more attention to be brought to these vulnerable communities and more services to be brought forward for them.
Thank you, Mitasha. The audio is still cracking. We would like to try something. Could you please just sign off and then sign in once again? We have a little bit of technical problem here, everyone. I would like to ask you to be a little bit more patient. Well, just to remind all of you one more time, today is World Sight Day, the 14th of October. Every year we celebrate World Sight Day, and today we are having a live Q&A session with our expert from WHO's Vision and Eye Care Program, Mitasha Yu, who will be joining us in a second. And
can you hear me any better?
Yes, I can hear you better, loud and
Okay.
clear. All right, thank you so much. Okay, she's back, everyone. So thank you very much for your explanation just now, Mitasha, and thank you everyone for sending in your questions. Seeing the first questions here, a viewer on Facebook asks, how often and who should get an eye examination or vision screening?
Yes. So thank you for that question, whoever asked it, because it's an important question. We recommend that everyone should get their eyes checked every 2 years. And the reason we recommend this, even if you're not having any symptoms or having any problems with your eyes, is that there are conditions in the eye that can be present in your eye without having any symptoms. So if we do regular eye checks, we can detect these early on and provide early intervention and treatment. And there's a chance for better outcome because of that. And if you have a condition that's being managed by your eye care provider, they may want to see you more regularly. So go on their advice. They might say every 6 months or every year, but really have that conversation and discussion with them. And who should get the eyes checked? So really everyone from newborn to the older age groups, everyone should get the eyes checked. Newborns are usually screened at birth, and children will be screened around the time when they start school. If parents notice some issues with their children's eyes, then they should get them checked. So issues such as red eyes or watery eyes, and or even an item, they should get that checked. And they might even have issues with some learning or developmental milestones. This can also be linked to the eyes, so that's another reason to get the eyes checked for children. And now with short-sightedness on the rise, so that's the ability to see close up but blurry in the distance. Half the world's population is said to have this by the year 2050. It's imperative that we check our children's eyes regularly so that we can detect any issues and provide an intervention early on.
Thank you, Mitasha. Well, everyone, here's that. If you love your eyes, just get your eyes checked.
That's
So
right.
we have a very interesting question from a viewer on Facebook, Mitasha. Actually, I just wanted to say we are working more and more at home, right? Since the pandemic started, like teleworking and stuff. And I think a lot of people want to know how to protect our eyes when we spend so much time in front of the screen, whether for working or just watching movies. And I have one question from Facebook, which is related to this. Uh, she said, "Hi, Natasha, Mitasha. I spend a lot of time using mobile and computer screens as part of my personal and professional activities. I have been using glasses since 8 years for long distance. Could you please tell me what kind of steps can I take to maintain healthy eyes?"
Okay. So thank you for that question. So firstly, you're doing great because you're getting your eyes checked. And I hope that you do get it regularly checked just to see if there's any changes in your vision. Secondly, when you're using your devices, whether it's a phone, an iPad, or laptop, you're using your eyes in a way that is not it's not meant to be used for long periods of time. You're meant to be able to see very dynamically in the world. You're meant to see close, far, and middle range, not always just close for a long period of time. And that's why your eyes can start to change and the distance becomes blurry for many people. So, if you're having to focus close up for your job or for your studies, we recommend the 20-20-20 rule. So, this is a really good behavior change that you can incorporate into your everyday life that will help you and reduce the strain in your eyes that you have. So 20-20-20, remember those three 20s. The first 20 means every 20 minutes, give your eyes a break. And the second 20 means look at something that's 20 feet away or 6 meters for those in the metric system and look away for 20 seconds. That's the third 20. So every 20 minutes, give your eyes a break for 20 seconds and look at something that's 20 feet away or 6 meters. And that will give your eyes that break that it really needs to look at that dynamic range of vision. And it's even better if you actually get up and walk outside and spend some time outside because that's better for us. But if you have to, you can stay in your spot and do that quick rest break that we have, the 20-20-20 rule. Another thing that happens is that when you're looking at your devices, you tend to actually blink less. So you may have some uncomfortable feeling, irritation, and some dry eye feeling. So this is something that when you take the rest break, you will force your eyes to blink. So it will help that issue as well. If you continue to have some dry eye or uncomfortable feelings, please see your healthcare provider or your optometrist, your ophthalmologist, or whoever you can access in your area. And they may prescribe some dry eye drops or even go to your local chemist for that. Yeah, I think that's very good things that we can incorporate into our everyday. Another small tip I can add is that if you're looking at your device for a long period of time, you try and make sure you have good lighting around you so that you're not just the device is not just bright on your face and everything else dark. You want to have balanced lighting, and by having a good light outside or around you, you reduce the strain that's caused on your eye from the device. So those are some tips you can put in your everyday life.
Well, thank you so much, Natasha. That's very, very useful. I love the golden rule of 20-20-20. Every 20 minutes for 20 seconds and 20 feet, right?
Or 6 meters.
Thank you. All right, Mitasha, well, our team slides in some more questions from our viewers. Let's do something fun and debunk some common myths about eye vision and eye,
Mhm.
shall we? All right, I have the first myth here. What do you say if someone tells you that wearing glasses or contact lenses will weaken your eyes further?
Okay, so this is a common myth,
Yeah.
and it's not true. So using your glasses or your contact lenses does not weaken your eyes. What actually happens is that when we use these corrective devices on our eyes, we, meaning our eyes and our brain, realize how comfortable it is when we wear the correction. And we tend to then start having a preference for it. You know, if you're struggling from eye strain and you put something on your eyes that reduces that strain, it feels good. So we say, okay, next time I want to look at my device or something, I'll put the glasses on. And then that tends to you start relying on it. It's not that your eyes are weakening, it's just helping and providing relief for your eyes.
Oh, thank you. This is fun to debunk some myth with an expert. So the next myth Mitasha will help us debunk is if you cross your eyes, they will stay that way. Is that true?
I'm sure many parents have said this to their kids when the kids are making faces at them. Don't do that. You know, your eyes are going to stay that way. But yeah, it's a myth. It's not true. It's just you using your eye muscles in a way, you know, for fun, and it doesn't damage your eyes if you do this for short periods of time. On the serious side of this, some children are actually born with crossed eyes or an eye turn, and that can be due to a few reasons. So your eye muscles might not be working properly, or your ability to focus has not developed properly. And depending on the reason, it can be corrected with glasses or vision therapy or surgery. And in some cases, children can outgrow these crossed eyes. So always see your eye care provider to get proper advice on that.
Wow. Okay. All right. Um, so next stop. What do you say if someone tells you losing vision naturally happens with age? I think this is interesting to hear from you.
Yeah. So there is a lot of cultural sensitivity around this too, as in a lot of cultures, it's, you know, one of those things you accept as you're getting older. And it's not really the case. Most people do get cataracts as they get older or have need glasses to see, especially things at close. But it's not something that we need to accept and we need to sort of not have any treatment for. So, you know, people leave their cataracts in their eyes and wait till it's ripe because they think it's just part of aging. And, you know, leaving it till it's ripe to actually make getting some treatment can actually be complicated and make the surgery more difficult. So it's best to get treatment, get your cataract removed when you feel it's impacting your daily life, and the earlier is better than later. And so, you know, another example of why World Sight Day is here, we need to bring awareness so that people understand that this is not a normal part of aging they need to accept. They can get treatment, they have sort of ways to correct this, and they can be productive and live their lives well, in good health, in good eyesight, if they get the treatment.
All right. Thank you so much. So just get your eye checked, everyone. Just a
That's right.
reminder for all of you who just joined us halfway, our program today is on vision and eye care. We have Mitasha Yu, a specialist in vision and eye care at WHO to answer your questions. You can send over your question or anything that you wanted to share with us using hashtag AskWHO on Twitter, or just leave your question in the comment section if you're watching us on Facebook. So we have quite a few questions coming in now, Mitasha. Ayuva from Facebook ask, can all glasses be recycled in any way, or should they be thrown away if prescriptions change?
Yeah, so there's a few methods of recycling that people have tried in the past. You know, there were donations where you would go give it to a charity, and then the charity would use them and give them to places that don't have good access to glasses. Now, over time, we found that's not the most effective way of providing eye care services to places that don't have access to glasses. It's not cost effective, and it's actually poor developmentally for development practices to be providing these old glasses in countries that really need good technology and good glasses. So the best way is that you ask your nearest eye care provider if they have a recycling service in terms of plastic. So we all care about the environment. We all don't want to use that much plastic. We want to reduce the way we put things in landfills. So if there's a recycling program for your frames or your lenses that your eye care provider has locally, that's great. Or you can recycle the frame. If you're still happy with the frame, you can, when you get your next pair of glasses, you can keep the frame and just replace the lenses that have changed. There's a few different ways of recycling glasses, but we don't want to recycle it in the sense of giving it to someone else to use.
Thank you, Natasha. Very useful tips. I've got another question from a viewer on Facebook. Uh, Hi, it's Miriam from Tunisia. So she's from Tunisia. Is there a way to fix and correct vision naturally without surgery or using eyeglasses?
Well, that's a layered question. It really depends on what the eye condition is. So in children, there are vision therapies that can be used if they are not focusing well or using their eye muscles well. So that is a technique that we use in eye care, and I guess you could call that natural. But there's nothing that unnatural about wearing glasses or getting surgery. It's a method of treatment. It's a very effective method of treatment, and we should advocate for it and its benefits.
Thank you. All right. Here's an interesting question from a viewer on Facebook. Once again, is it true that conditions such as raised blood pressure or cholesterol can be detected via an eye checkup?
Yes, it is true. So the eyes are to the window to your soul, as many people say, but it's actually also a window to the general health of the body. There are many blood vessels in the eye. So what is happening in your blood vessels in your body shows up in your eye. So when your eye care provider has a look in your eye and can see the blood vessels, they can sometimes see those changes very early on. So diabetes is one of them. You might see some changes in your eye with diabetes very early on, even before people have realized themselves they have diabetes. Hypertension, as the Facebook person said, high cholesterol can also be shown in the eye. So it's really important that when you do have your regular eye checked, you tell them if you have any of this history in your medical history as well as family history. So the person that's checking your eyes can especially look out for this.
Thank you, Mitasha. So I think so far we have covered pretty much some of the most important questions, and you may have mentioned here and there already about the
Mhm.
Golden Rule 2020. But it would be useful and helpful if you could explain to our viewers one more time, for those who just joined us,
Mhm.
about the steps and how can we prevent serious vision impairment and blindness in everyday life.
Right. So number one golden rule is get your eyes checked. That's, as mentioned before, there are many conditions in the eyes that can be present and you don't actually feel it. You don't see, your vision doesn't get affected, and they could be bubbling away inside. So we need to get them detected early, and so that we can provide treatment early. So having that regular eye test, particularly for people, as mentioned, that have diabetes, that hypertension, if they have a family history of glaucoma, if they're children and they have parents with short-sightedness, there's a family history link there. So again, just get your eyes tested. Secondly, if you're out in the sun a lot, it's a good idea to protect your eyes from the ultraviolet radiation. So wearing sunglasses or glasses that have a UV protection layer, that's also important. It not only protects your eyeballs, but the skin around your eyes as well, because there's cancers on the skin of your body as well as the delicate skin that's around your eyes. Another thing important is that if you work in an industry or a place that is high risk for eye injuries, so you could be in sports or farmer or construction worker or even welder, you need to wear your protective eye shield. It's very important that these protective gear, as you'd wear gloves, if you're doing something risky with your hands, you'd need to do that with your eyes as well. Yeah, so those are some steps you can take to make sure that you are on top of any vision impairment or blindness.
Thank you, Natasha. Thank you very much for a great explanation. So I think we have received quite a few questions that I think would be interesting to get them answered. Tracy on Facebook's asking, so where we talk about eye surgery and treatments. Do you recommend LASIK, or LASIK is recommended for
Yeah.
treating eye disease?
Yeah, so LASIK is a very safe surgery, and if you have access to it and the means to fund it, this is something you discuss with your eye care provider. They will check your eyes to see if you're suitable. Many, many tests will be done. They won't do it on you if you're not eligible. So, things like the health of your eyes, very important to be checked. Your actual prescription for your glasses, if it's stable over a certain amount of time, it doesn't keep fluctuating. And I guess the amount of correction that needs to be done will also be taken into consideration. So there are a few measures to be checked before you go in for the surgery, and that's something you discuss with your eye care provider. But it is a safe surgery that's been around for a while. And if it's something that you think you'd want in as part of your life and it's suitable for you, then yeah, that's good choice.
Thank you, Tracy. I hope you get your question answered. All right. Thank you, Natasha. I think we are running out of time now. Before we close our live session today, I think there's a viewer on Facebook, Veronica, asking this question too that I already have prepared for you about WHO's role and response to prevent blindness and vision impairment around the world. So perhaps you could tell us what we have done so far and then what we are planning to do in the future regarding our works in eye vision and eye care.
Yeah, so thank you for that question. And WHO has been and is committed to working in countries to improve the delivery of eye care, in particular through primary health care and integrated people-centered eye care. So we really want to see these services as part of the health system, and be people-centered. So WHO released a report called the World Report on Vision in 2019. And this report really provided the evidence and the effective strategies and recommendations that help countries boost their efforts in reducing the burden of eye conditions and vision impairment. So now that report's released, the Vision and Eye Care Program at WHO are developing specific tools and guidelines that will assist these countries to implement the recommendations. And that's where we are heading at the moment, in the work we're doing.
Thank you very much. All right, everyone, if you want to learn more about WHO's key area of work and activities in the prevention of blindness and vision impairment, please visit our website, www.who.int. Thank you for everyone for tuning in today from all over the world as usual, from Brazil, USA, Philippines, Bangladesh, Mauritius, Nigeria, India, Libya, Indonesia, Cambodia, South Sudan, Thailand, UK, Laos, Afghanistan, Kosovo, Angola, Malawi, Tunisia, Canada, and many others. Thank you for sending us questions and sending in your thoughts in the comment section. And also thank you very much, Mitasha, for taking your time to talk to us today. It was very useful.
Thank you, everyone, and happy World Sight Day again to everyone.
Thank you. And last but not least, everyone, if you liked this, give us a thumbs up or share it. If you loved it, do go follow us if you haven't already on our social media platforms for upcoming and exciting activities from the World Health Organization. Thank you again, and until next time.